There has been a worrying surge in the number of flu cases here in Korea this season. So what are the statistics telling us about the severity of this latest spread of flu? Are these concerns boosting flu vaccine uptake? And do we need to get the COVID-19 vaccine as well? Welcome to Issues and Insiders. It's been a while since we touched upon issues related to health. So today we have a panel of doctors to talk about the rise in flu cases in recent times and the importance of vaccines and more, of course. For this, I have Professor Kim Moon Kyu from Yonsei University here in the studio. Professor Kim, it's a pleasure to have you back.
Thank you for having me.
I also have Professor Peter Chin-Hung at the University of California, San Francisco, live on the line. Professor Chin-Hung, it's been a while. It's great to speak to you again.
Same here, Sunny. Thanks for having me on.
Right. Professor Kim, we'll start here. I understand flu cases in the country are soaring this particular season. What more can you tell us?
Well, this autumn, the doctors who see the patients have to think both COVID-19 and influenza right now, especially if the patients are febrile. And usually COVID cases are nowadays reinfection, which means the symptoms are mild compared to the first infection. By contrast, influenza are usually abrupt onset, and they have high fever with muscle pain and severe sore throat. And consecutive infection is quite uncommon in influenza. So usually, if you had a influenza a few months ago, it's not an influenza if you have another febrile illness. Nowadays, we have about 15 cases of influenza in every 1,000 outpatients, and if it's more than 6.5, we call this prevalent. And actually, we had a peak of influenza in July, mid-July, and it started to decline for 6 consecutive weeks, but we have a resurge in September. And especially among students, because they started a new semester in September. And if we look close into some elementary school ages, 7 to 12, they had about 50 cases for every 1,000 patients a few weeks ago. Now it's slightly decreasing, but still we have a high incidence, and people with high risk, especially elderly, more than 65 years of age, and having underlying conditions, they should be vigilant. And since we still have COVID-19, and it's very hard to deal with 2 infectious disease at the same time, especially in emergency departments. So I wish that either one should subside down as soon as possible.
Right, hopefully, of course. Professor Chin-Hung, what is the spread of the flu like that in the U.S. this season?
So far, Sunny, it's relatively low levels in most of the country. There are some places like Alaska where they're seeing moderate levels. But again, we are not resting on the laurels. We expect that there will be a robust flu season in the United States eventually. But it is coming a little bit later than last year. And last year, the 3 viruses, COVID, influenza, and RSV, the 3 main ones, took turns in when they surged. But this year, they may all come together, and I think that might be worrisome.
And given that scenario, Professor Chin-Hung, have such concerns about a potential rise in the seasonal flu that, along with these other viruses, boosted the uptake of the flu vaccine, do you think, in the U.S.?
Well, interestingly, Sunhee, the flu vaccine uptake is higher than the COVID vaccine uptake at the moment. About 18 million Americans have gotten the influenza vaccine, and only about 12 million Americans have gotten the COVID new vaccine this year. Part of it may be the way in which COVID vaccines are paid for. There are a lot of different ways. So if you have insurance or you don't have insurance, you may get some obstacles. But influenza is a well worked out way of distribution. So that might explain part of it. But you're right. I mean, because we're seeing low levels of flu in most of the country now, It's probably explaining why not a ton of people have gotten their flu vaccines yet. Usually you see a neighbor or somebody going to the hospital, and that's an incentive to get it. So because the levels are low, we're seeing, maybe 3 or 4% of the population.
And Professor Chin Hong, for those who have yet to get their flu vaccine, do you suppose it's still okay time-wise, or is it too late to get your vaccine for this season?
First of all, I would say it's perfect timing right now. One of the issues is that the vaccine usually, depending on the manufacturer, has 3 or 4 types. And so if you get infected with one, there's still potential benefit. But like Dr. Kim says, usually when you get one flu, you don't get it again for the rest of the season, but it's theoretically possible. And the flu season is generally longer than, say, RSV. So even if you don't get it, by the holiday period, it may still linger until, in terms of risk, until February to April even. So to answer your question, it's never too late to get the flu vaccine.
Right, noted then. Professor Kim, what about here in Korea? Are a greater number of people seeking the flu vaccine this season?
Well, it is recommended to get vaccinated before winter season, and it's best to have the shot before November. And if you are getting the influenza vaccine for the first time, you need another one after 4 weeks. And if you belong to the age more than 65, it's free of charge in Korea. So because they are in relatively higher risk, and these age group have a higher incidence of vaccination rate, but it's only about 10% right now. It's not that satisfactory. So more people should have this vaccination. And especially if you didn't have influenza for a long time, or maybe 1 year or 2 years, your immune memory is almost weak now. So those people should have vaccination before November.
Right, I see. Professor Kim, earlier on you spoke about the concerning spike perhaps in cases of COVID-19 here on the local front. Is this prevalent or more seen within the elderly or the young children? And in the case of vaccines, is it okay to receive the COVID-19 vaccine as well as the flu vaccine at the same time?
Well, the second question, having those two vaccines altogether is allowed. It's already recommended by WHO and many health authorities in USA and in Japan and even in Korea. So if you need 2 vaccines altogether, yes, you can have it. But if you had a COVID vaccination within 3 months, you have to wait for that period. And now as COVID-19 has downgraded to the level 4 in Korea, we still have severe cases and mortality among elderly people with underlying conditions like diabetes, severe obesity, and chronic lung disease, etc. In Korea, we still have a subvariant of Omicron, which is XBB and EG.5. But the vaccines we have right now I think it's working for that. It is effective. So in Korea, the COVID vaccination started from mid-October to March 2024. So you can have the vaccine during that time for age more than 65. It's for free. But the other age group, they will start from the 1st of November. So next week, maybe we can have those vaccines available. And the vaccine we have for COVID-19 is a monovalent vaccine for XBB right now, and it's both from Pfizer and Moderna. You can have this. Okay, so having vaccine altogether, 2 shots at one time is possible.
Right, I see. Professor Chin Hong, what's the latest on the COVID front there in the U.S.?
Well, Sunny, on some levels, it's looking good, meaning that wastewater is coming down, hospital admissions are coming down, emergency room visits are coming down, and test positivities coming down. However, one index is showing an alarming increase, and that's deaths. So despite everything else coming down, over the last week or so, the US has seen about a 3% increase in deaths. And that really is an average. So if you look at some states like Arizona or Florida, they're seeing close to 100% increase in deaths. Nothing like last year around this time, but still, when you look at the total number of deaths so far from COVID in the United States, it's about 60,000. And that's before what we expect to be a winter increase in cases. When you look at a normal influenza season in the US, it's 35,000. So again, it's a new, threat that we have, again, coming that we didn't have before 2019. So that may put a strain on hospitals. So, I think the tragedy is that most of these deaths are preventable. And they're really driven by whether or not, particularly in the elderly population, they've gotten a recent vaccine or not, because we know that immunity wanes the fastest in those who are older than 65. So again, that is really something that's concerning me, because there are available vaccines, but yet the people who need it the most are not necessarily getting it at the same time. And even if they didn't get vaccines, early therapies like Paxlovid and Remdesivir can keep people away from the hospital. But again, because people are not always accessing those medications, we have all of these deaths still here. So I guess at the end of the day, people are hoping that the deaths from COVID and the cases will go all the way down and then come back up again in the winter. But it seems that it's settling to a plateau and then going back up again.
Right, unfortunately. Professor Ching-Hun, I understand that despite the concern with regard to the rise in death toll, of course, the symptoms of COVID-19 at present have marked a certain shift. I understand that most cases are a case of mild throat aches as well as congestion. Could you tell us a bit more about that?
Yes, so as the variants have evolved from Alpha, Delta to Omicron now, and particularly with the XBB variants, people are having, in general, mild symptoms. So runny nose, congestion, headache, sore throat is very common. And like Professor Kim said, sometimes you can clinically distinguish it now from influenza, because influenza is more sudden. You tend to have more fevers with influenza. Your whole body aches. So that is separating itself out. However, because there's a lot of overlap, and because these symptoms that you have that might be COVID, might be allergies, might be a cold, might be RSV, can be confusing to people. Sometimes the only way you can tell them apart is by diagnostic testing. But we only have at-home testing for COVID right now. I think in the future, having at-home testing for influenza and COVID at least will be helpful, because that's something you can take an action on. If you are positive for influenza, you can take oseltamivir or Tamiflu, which can shave off time off your illness or prevent hospitalization in some. And if you, of course, have a positive test for COVID, we know that some people will benefit from Paxlovid and other early therapies.
Right, of course. Meanwhile, Professor Kim, another concerning development here in Korea is perhaps a jump in the cases of tuberculosis among the elderly following the lifting of face masks. How severe is this particular situation here?
Well, I'm not sure whether it's because of we are not using face mask anymore. The instance of tuberculosis was declining for the last 11 years, but in 2023, the incidence increased about 0.1% for the first time during that time. And we have about 1,000 deaths from tuberculosis each year, which is the highest among OECD countries. The tuberculosis has a reproduction number of 2 to 2.5, which is almost similar to the original Wuhan strain of COVID-19. But if you compare with chickenpox and measles, it's quite lower. But if you are aged more than 65, you have more chance to get tuberculosis. Now it's about 5% increase in Korea. But in younger age group, the incidence of tuberculosis declined. So why does it happen? We don't know yet, but I can tell you the typical situation of transmission of tuberculosis is you sleep in the same room with a person who have tuberculosis and the person is coughing. If you sleep together, you have a very high chance to get tuberculosis. Usually tuberculosis bacilli is very weak to sunlight, so you don't have that much chance to get this infection during daytime. And maybe we might have some reactivation of tuberculosis among those elderly group and patients who have diabetes. So during the pandemic, it's just my guess, but during the pandemic, maybe we have a less outdoor activity and the elderly people might have a lower level of vitamin D, which altogether resulted in the increase of tuberculosis in the elderly group. So it's very slowly progressive, but still it's a fatal disease, and it's very difficult to take medications for many months. So you have to be proactive to prevent it, and if you get tuberculosis, you must follow the orders of all those medications.
Right, and talking about prevention, Professor Chin Hong, do share with us some ways perhaps to stem the transmission of tuberculosis.
Yes, so I think the first thing before we talk about prevention is just reviewing how it's spread. So it's spread really by the airborne route primarily, and like Professor Kim said, really coughing next to someone in a poorly ventilated room is probably the best way to get it. But there are probably 5 things to think about when you prevent tuberculosis and the methods that we have. The first is the air. So if you increase ventilation, if you have symptoms, you wear a mask. And healthcare workers, of course, wear specific masks because these particles are very small and can linger in the air, and these are N95 masks. You can boost the immune system, particularly if somebody has a low level of immune cells, for example, HIV patients. You boost the immune system by giving antiretroviral therapy. You think about vaccines in some countries where the prevalence is high enough, and people would have heard about the BCG vaccine. Unfortunately, it doesn't prevent as much lung disease, but it's really good for other kinds of severe disease like meningitis. Testing is the 4th way of preventing disease, because if you test and you know somebody has tuberculosis or what we call latent tuberculosis, you can isolate them or treat them and then prevent them from spreading it to other people. And then, of course, the last method is the medications that we have. You treat somebody early who has TB, you not only save their life, but you save them from infecting others.
Right, indeed, I see. Beyond the present health concerns that we've talked about, Professor Kim, let's now touch upon very briefly, because we have a few minutes left, on a rather sensitive issue here in the country with regard to Korea's medical industry. Now, for the sake of our viewers who may not be very familiar with this particular issue, could you tell us a bit about the dilemma that we face?
Well, as I work in an emergency department, I always care about this, I worry about this critical care service, I believe that they should have a priority, and rebuilding up the critical care personnel is something very difficult. And already we are facing lack of manpower, especially in regional hospitals. And increasing medical students never guarantee high quality critical care. And which departments are facing this problem? I think almost all the departments who take care of critical patients are facing the same problem. They are in lack of persons. And if we continue like this for a few more years, everybody is going to feel this is a very serious situation. And I wish that the government will try to reduce unnecessary expenses of the medical expenditure and prevent financial leakage. And I know how to do ultrasound. I had to learn for many, many years to learn how to do this technique. But there are some medical personnel, like home medicine doctors. Now they can do ultrasound, and it's something unreasonable for us. So I wish that this kind of trouble will be fixed in the near future.
Right, hopefully, of course. And in the meantime, then, generally speaking, Professor Chin Hong, what do you propose to protect the interests, perhaps, of medical workers in general, as well as the health of the broader public, as we move very quickly towards an aging society?
Yes, Sunny. So I think the problem, as outlined by you and Professor Kim, is that we're spending a lot more money because our population is aging. Healthcare personnel are retiring, and we've seen this trend of not having enough physicians even before the pandemic. It's estimated in the United States, for example, by the year 2034, that we'll have a shortfall of about 100,000 physicians, particularly in some areas like intensive care, unit care, emergency medicine, psychiatry. These are some of the areas. And so how do you address this? I think we need to increase the number of medical personnel that we're training. Many countries like Korea, like the United States, have a cap on the number of people that they train. So I think we need to really reevaluate that and have more people trained. It takes many, many years to train physicians. So I think we have to take action now if we want to think about the future. A second solution will be using AI, big data, to not only think about making our hospital systems more efficient, for example, trying to get people out of the hospital, get new people in a more efficient way using some of these new technologies we have. AI is also being used for thinking about early diagnosis at point of care testing and point of care evaluation that people can use to triage. So we have to rethink that. I think we have to rethink who's providing care. In the United States, we're utilizing a lot more advanced nurses, like nurse practitioners and physician assistants, to do basic first-line care, and then eventually that goes on to more specialized care with physicians. So I think that's all being used. At the end of the day, though, the COVID pandemic has really exacerbated burnout and more people leaving the profession. So I think we need to also think about the happiness of people in the healthcare field, which is, a grueling profession, even though it seems glamorous when you look at TV, because it's long hours, it's stressful. And when you take care of a lot of sick patients and their families who love them, it can really have an impact on you when you go home. So all that is leading to burnout and long hours, a lot of data entry and charting. Right. So we need to really have a multifactorial approach.
Right, of course. So right there. All right, Professor Chin Hong, as always, thank you so much for your insights today. And Professor Kim here in the studio, thank you very much for your time and your thoughts.
Thank you.
Right, well, for those of you who have yet to get your flu shots, please do so to stay protected against the virus this season. Thank you for watching. See you same time tomorrow. That is Friday.